Deschutes and Jefferson counties each have one new case of COVID-19 today. St. Charles says the pandemic has cost them millions of dollars. Rhea Piniella has details of the cuts they're making to get back on track.
Like other health systems across the state, the St. Charles health system is trying to recover from the financial effects of the COVID-19 pandemic. The St. Charles health system says it lost $39 million in patient revenues following canceled elective surgeries and patient restrictions. Meanwhile, it says its expenses increased to prepare for COVID-19. This includes extra hospital beds, PPE, ventilators, and technology for virtual visits. The cost, an estimated $6.5 million, according to St. Charles staff.
So what the efforts we're making now are not trying to recoup those losses, because we're really focused on grants that are available, CARES fund that are available to try to restore that.
In addition, the executive care team's taking a 10% pay cut until the end of the year. The system's also offering caregivers 3 voluntary programs to help with their financial recovery, including reduced hours, unpaid time off, or summer sabbatical. Kevin Mealy with the Oregon Nurses Association says he's concerned about the health system's proposal.
And it's short-sighted to cut caregivers during a pandemic while we're trying to rebuild capacity and prepare for the long-term health effects.
St. Charles Health System is by far Central Oregon's largest employer. But Jen Wheelander, St. Charles Chief Financial Officer, says they won't hire more workers unless they're absolutely necessary.
Our focus is the caregivers that we have here today and challenging ourselves in innovative ways to get the work done with the resource and the team we have.
Lisa Goodman, St. Charles Public Information Officer, says clinical caregivers could be called off shifts if there are not enough patients. During the pandemic, the healthcare system paid caregivers for the shifts they were called off. But come mid-June, Goodman says that will stop. She also says no workers will be laid off or furloughed. All of these efforts are part of the St. Charles Health System's goal to break even for 2 months by the end of the year. But the continuing financial impact due to COVID-19 remains unclear. In Bend, Rhea Piniella, News Channel 21.